This cream is used to treat skin conditions such as eczema, ringworm, athlete's foot, and jock itch. It contains 2 medications, iodoquinol, which is an antibiotic that prevents the growth of fungus and bacteria, and hydrocortisone, a corticosteroid that reduces swelling, redness, and itching in the affected skin. It is best to apply this cream to the affected area as directed by your doctor, usually 2 to 3 times a day. Make sure to wash and dry the affected area before applying the cream. Remember to use this medication regularly to get the most benefit from it. When using Iodoquinol-Hc 1% to 1% topical cream, make sure to only apply it to the skin. First, clean and fully dry the affected area. Then, apply a thin layer of the medication and gently rub it in, following the instructions given by your doctor. This is usually done 3 to 4 times a day. Remember to wash your hands after applying, unless you are treating the hands. Avoid wrapping, covering, or bandaging the area unless directed by your doctor. And make sure not to apply the medication in the eyes, nose, mouth, or inside the vagina. If it does come into contact with these areas, flush with plenty of water. It's important to use the medication regularly at the same times each day to get the most benefit from it. Also, continue using the medication until the full prescribed amount is finished, even if your symptoms improve before then. Stopping the medication too early may result in the infection coming back. If your condition lasts or gets worse, be sure to inform your doctor. If you experience dry skin while using Iodoquinol-Hc 1% to 1% topical cream, be sure to consult your doctor or pharmacist if the condition persists or worsens. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any of the following serious side effects: skin irritation or burning, excessive hair growth, thinning or discoloration of the skin, acne, stretch marks, or small red bumps on the skin, folliculitis. Using this medication for extended periods or repeatedly may lead to a new infection, so it's important to contact your doctor if you notice any new symptoms on your skin. While it is rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist for advice. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada. Before using Iodoquinol-Hc 1% to 1% topical cream, make sure to inform your doctor or pharmacist if you are allergic to iodoquinol, hydrocortisone, 8-hydroxyquinolines, other corticosteroids, or iodine, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, inform your doctor or pharmacist about your medical history, especially if you have immune system problems, poor blood circulation, tuberculosis of the skin, or viral skin/eye infections such as herpes or chickenpox. Be cautious when using this cream as it may stain the skin or clothes. Try to avoid contact with clothes. If you are using this medication for a child, be aware that they may be more sensitive to the effects of corticosteroid medication. It's best to consult your doctor for more details. If you are pregnant, only use this medication when clearly needed, and be sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication, as it is unknown if the medication passes into breast milk. When using Iodoquinol-Hc 1% to 1% topical cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, such as certain thyroid function tests and tests for phenylketonuria, which could result in false test results. It's important to inform lab personnel and all your doctors that you are using this medication. If this medication is ingested, it can be dangerous. If someone has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention. In the United States, you can contact your local poison control center at 1-800-222-1222, while residents of Canada can call a provincial poison control center. Remember, it's important not to share this medication with others. This medication has been prescribed specifically for your current condition. It's not recommended to use it for another skin condition unless your doctor advises you to do so. In that case, a different medication may be necessary. If you forget to apply a dose of Iodoquinol-Hc 1% to 1% topical cream, apply it as soon as you remember. However, if it's almost time for your next scheduled dose, then it's best to just skip the missed dose and continue with your regular dosing schedule. It's important not to apply a double dose to make up for the missed one. When it comes to using Iodoquinol-Hc 1% to 1% topical cream, it's important to store it at room temperature and away from heat. Make sure to keep it out of reach of children and pets. And when it comes time to dispose of the cream, be sure to do so properly. Don't flush it down the toilet or pour it into a drain unless specifically instructed. Instead, consult with your pharmacist or local waste disposal company on how to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.